It's great to be here at AHIP this year, 2013. It's clearly an exciting time in the industry, an exciting time at Softheon. So we have been proud and privileged from a key technology provider to some of the latest innovations coming out of the industry, if you will. A little bit about Softheon, perhaps, is that this has been basically a 10 plus years of research and development had given the Softheon the opportunity to be a major contributor to the advancements that are taking place within the healthcare payer technology space. We are basically a research and development firm with nearly 200 plus professors and faculty members located at the Stony Brook University, which is part of the State University of New York system. And the Stony Brook University and the Center of Excellence in Wireless Information Technology Center has been the home for Softheon to come up with these, I will call the cool, innovative technologies over the last 10 plus years. Our core competency has always been technology. So over the years, as we have the opportunities to commercialize or creating the platform, if you will, and new ways of doing things. And one of the applications, in fact, we had a chance to participate in early days, and we just didn't know even what Exchange was, the Massachusetts Health Connector project. Dating back to 2008, when we were given this wonderful opportunity to creating a technology platform for state of Massachusetts, as they came up with this wonderful idea about how to reduce the uninsured rate within the state, as well as able to creating a ways of bringing the costs aligned with the expectations. So the Health Connector has been an exciting an experience for us. Since 2008, we have been a critical part of their day-to-day operations, which we feel proud and privileged to be a part of that solution. Obviously, that kind of connector led the way into the critical component, or being the model for the Accountable Care Act, as being a state-based exchange platforms. So to this day, that connector, we work with nearly 50 plus operations staff on the business and contact center with our partners. Obviously, working with the connector authority on the state side, and we serve the nearly over 200,000 members of state of Massachusetts. Through the connector program, Massachusetts has the lowest uninsured rate among the states, while we're able to come up with creative ways of serving that community otherwise would have been perhaps uninsured. So the great experience has always been not to be able to be a participate in these innovative ways of fixing common problems, but also being able to come up with a technology, let it be out of the box or let it be an advancement towards the use of technology to addressing the critical aspects of that new ways of quote unquote delivering healthcare. So since 2008, we have basically participated every part of their enrollment program for individuals, as well as communicating and responding to their questions through the Softheon-driven technology today powers their CRM or contact center solutions. And we have gained a lot of experience, a lot of knowledge, a lot of know-how over the last nearly 5+ years or so. Obviously, there's just like any other experience, you learn from it, and you want to be able to bring that experience into the next project, into the next opportunity. So what we have done is we made a commitment going back to, again, 2008, and we wanted to bring the technology as a component of this of this new way of doing business. So over the years, we have then expanded our investment in the technology space, and today we call it as an edge computing. So I am very pleased to basically today introduce the concept of an edge computing for the healthcare payer IT space. So what is an edge computing? It's basically is a set of technology is designed to be targeting the people that are normally not inside of four walls of an insurance company. Historically, the technologies that are being utilized or consumed by the insurance companies and carriers, it's been either towards the automation or streamlining the enrollment process or claims adjudication or payment reconciliations. In some contexts, perhaps for provider management or utilization management. It's always been great tools. It's about measuring the productivity of the system itself, let it be the network adequacy of the doctors and providers' ability to serve their members, the carriers' members. But these systems are kind of, the primary purpose has always been about allowing the insurance companies, employees to be able to do their work more efficiently, just like any other industry. With the advent of Accountable Care Act, exchanges, and what we are seeing, a kind of a perfect storm, if you will, and what those are, if you really take into the context, is the effect of consumerism. Today's consumers are very much common to using devices like iPads and iPhones and Androids. Those devices has enough power, enough capacity to be able to use beyond their traditional meanings of being a phones or being a simple, the personal organizer. They can be now part of a much broader, much bigger systems that are designed to be a lot more towards the bringing the efficiencies to how the healthcare is being delivered and serviced in this country. So the effect of consumerism is a critical factor to it. The second big aspect to it is that the fee-for-services model, as we know that it is not something of a sustainable model. Perhaps initially that was not the really intent, but the model itself it doesn't lead itself into a healthier nation. I think there's many statistics around where the United States ranks up among the other developed OECD countries. And then meanwhile, while the quality of healthcare not necessarily has improved, but the cost continues to rise. So I think what we are going to see is another kind of the storm, if you will, is about the moving towards more of an outcome base, meaning that towards making people healthier. Well, how do you determine someone is getting healthier? What are the objective measures of tracking individuals' health? And we're seeing some critical parts of that, by the way, within the ACA, things around, penalties for the readmissions and so on and so forth. So that second effect of that provider-payer configuration or collaboration, it is a critical factor to it altogether. So Accountable Care Act, as we all know, it has many different elements to it. And one thing, again, is an exciting time for Softheon as an industry as well, is that what we see this Accountable Care Act as being one of the critical aspects of, but there are two additional components that is creating the kind of a perfect storm or perfect opportunity for the industry as well as the organization like Softheon. One opportunity or one other major initiative is that the consumerizations. So consumers are very much comfortable about using components, products like iPhones and iPads or other types of smartphone technology. These devices have the capacity to handle or perform much broader capabilities beyond what was designed and purpose for it. Let it be using them as part of an enterprise solution to keep track of individuals' health or simplifying their interaction with the insurance carriers or the doctors. So the consumerism aspect, individuals' ability to, especially the generational gap, becomes a much more evident thing in here. The other important factor about the quality of care, the fee-for-services model has been adapted and been used over the years has basically had some major flaws. We believe that the cost alignment of the fee for services against the quality of life, as being the U.S. is being ranked, I believe, 16th or 17th among the other developed countries from a life expectancy perspective. So we clearly know that that also business model is not going to be sustainable, and what we are seeing that basically outcome-based the processes or healthcare delivered towards the tracking the patients about their wellness. So if you take these three components all together, it creates a new paradigm, a new way of providing healthcare or servicing healthcare. And this is going to require a new set of innovations, a new set of technologies that are being adapted by what we call basically healthcare delivery supply chain. And so in that context, what we are seeing, the organizations, some of the early adapters and some of the innovative carriers or innovative insurers, what we are seeing is they are leveraging their existing assets that's always been there for the last however many years, made significant investment, and they do what they were supposed to be doing. What we are seeing is, however, is that towards this aspect of the Expedia, like, or online banking like experience with working with interacting with the insurance companies or the providers, that gonna require a lot more what we call the edge computing. So what is an edge computing? Basically, these are a set of products or technologies that are developed for enabling consumers and providers or other participants in this supply chain of healthcare service and delivery to interact with one another in a much more meaningful and much more real-time manner. So in essence, rather than doing the historical model has been the daily, weekly processes that are being adapted, we are talking about the experience of buying a car right on eBay, or this date, by the way, the mobile computing, mobile platform of eBay is the fastest growing part of their business. Same kind of experience, obviously, very evident in the travel industry, let it be through Expedia, Travelocities, or in online banking, even in property casualty and other types of financial products out there. So the edge computing enables organizations to talk with one another, talk to their consumers, talk to their partners through these real-time services. So the products like Softheon delivers today, we have this flagship product that we are very excited to announce at the AHEB 2013, gives the organization ability to engage with their consumers, with their brokers, with their trading partners real time, if not near real time. And we do this by leveraging and establishing a trusted relationship with the technologies that are designed to be real-time consumer-facing, as the technologies that are designed for internal use or consumption by the staff or the employees of the insurance carriers. So one of our first practical application of our Softheon's edge computing platform is the Exchange Connector. So Exchange Connector is designed to be the primary bridge between the health plan's existing systems that are, let it be designed around provider networkings or initial enrollments and underwriting or other types of ongoing payment reconciliation or claim system. And so we have a magical way of connecting these systems with the type of services are required by the state exchanges, by the applications like iPhones and iPads. So that gives us the ability to provide an incremental system, incremental solutions to the organizations that are being very successful in the past, but now they need to adapt to this new way of providing these services and delivering healthcare in general. So that kind of brings us to the future. So where do we see the healthcare payer IT space, if you will? Again, there are many predictions, many consulting firms that we do know that they kind of project what's going to happen within the 5-10 years. To be frank, 5 years is a long time. Not that many people, if they could go back in 5 years ago, where was Twitter or where was a product like Facebook about 8-10 years ago? We couldn't possibly even think about how pervasive those technologies has become part of our daily lives. So we see that the technology is being basically getting smaller and smaller, becoming more pervasive, meaning it becomes a critical part of your day-to-day activities. It's there, but you don't know it's there. We are thinking about a product like the one that we have developed in here, that basically we can see that tomorrow's insurance brokers will have the ability to simply sit across the table with their customers and being able to interact with them in real time, addressing and helping their needs, rather than filling out of papers or being on the phone for extensive hours and being able to, complete the same exact kind of activities in matter of minutes, not in days, definitely not in weeks. And unfortunately, that's some of the processes, that's how long does it take to do that today. The other type of technology that we're going to see is with the proliferation of the technology, just like everything else. We believe the fraud and abuse aspect is going to be another critical the component that has to be taken into account. It's no secret that even today that there are issues and challenges around the privacy issues. Now think about that technology tomorrow having things like location-based tracking. Now again, using the existing security measurements, we see that location-based services being a critical part of healthcare delivery. That my iPhone application can actually tell my doctors exactly my whereabouts, possibly even capture my critical vital statistics about my heart rates, my blood pressure, and that information can be fed into my wellness program. And through that kind of a data capture that can be actually utilized from an individual's wellness, how well I'm recovering perhaps from a past surgery, and where am I, and how am I basically following those regimens, but as well as using that data in a very creative ways. And we believe that use of that data could lead to a healthier society. And this is how it can happen. Possibly one possibility, one scenario. Granted that these are all very sensitive topics, but we think that today everybody is aware of their, what we call it, a FICO score. If you're spending too much money, you have too much debt on your credit card, your FICO score, basically risk score, goes down. As a result of that, if you're about to go buy a car or house, your interest rates will be then proportionally will be increased because you become a high-risk individual to pay those debts. Imagine the same kind of concept is being brought into the healthcare space. Imagine through the use of technology, I am able to, insurance companies or carriers are able to incentivize the individual to perhaps lose some weight, perhaps get involved with some activities, which will then, quote unquote, increase or decrease your health score. And as a result of the improvement that you make on your health score, just like your FICO score, your insurance premiums perhaps can be adjusted. So this is the kind of creative thinking that we believe the cost containment will be something that's much measurable. We believe our individual health and wellness could be something, it could be aligned with the expectations, but for the good. Individuals become accountable. So if you speak to many experts today, is that the issues around the making sure that, how do we keep the consumer responsible of their well-being? We believe the technology is going to be playing a critical role. It has already started to do that. We're seeing a lot of vendors and a lot of product announcement towards wellness, product announcement towards basically a better provider-payer collaboration. Really what that means is that the people that have a vested interest, that the individuals, the consumers' health, are now being aligned to provide a unified end-to-end product and services. So once again, these are exciting times in the industry, and we are excited to be at AHIP and we have been kind of blessed for these given opportunities, and we are looking forward to coming back at the Fall Forum and telling you more exciting news and product announcements. And again, this has been a fantastic event.